वही फर्स्ट स्लाइड कर दो। आज जटिया है ना, क्या बात है आज पांच मिनट में चाय, 5 मिनट चाय पी ही जाएगी, 8 मिनट लगे। Just about 5 minutes to start.
डेस्कटॉप पे हो गया।
अच्छा ये हो गया ना, रहना चाहिए। बुला लेंगे जैसे स्टार्ट। डॉक्टर सुरक्षित को बुलाओ।
डॉक्टर गुड इवनिंग।
डॉक्टर सुरक्षित को बुला दो या डॉक्टर गुप्ता का पहले स्टार्ट पहले कर देता हूँ। हाँ हाँ एक मिनट क्या होगा
अच्छा
आइए आइए
बैठे हैं कोई वैल्यू तो बैठे हैं कोई देख रहा
डॉक्टर गुप्ता आ गए, डॉक्टर संजीव गुप्ता आ गए। ये आइज वन। हाँ जी हाँ
यस मारवा
उसी स्टार्ट कर रहे हैं।
स्टार्ट। मैं सर बिफोर मैं अपनी आई केयर कराऊं बताऊं आपको, पहले मैं आपको अच्छी तरह आंख भर के देख तो लूं।
ओके सॉरी
yes no let's start sir.
yeah let's try see ऐसे होता है। Okay, so
हाँ जी खोलो।
Pragati, we can start. Pragati, hello.
Yes sir.
Just change the. Yeah. So, Namaskar, welcome all of you. Today we have a hybrid wellness chopal, and this is a chopal which we have been carrying on since last 6 years, and today is session number 330. So today is one of those days that we are having this session in a hybrid form. हम यहाँ पे physically present हैं, plus the session is going online, and online we have at the moment around 60 people who are online. So this session we are doing from last 6 years. हमारा कोशिश होती है कि we don't talk about diseases alone. We talk about those issues that are affecting quality of life of elders. Because more important is just not life, but quality of life. So that is what is our emphasis always. Pragati, next slide. So we welcome all of you. It's representing different organizations, different associations, and
आवाज आएगी जी तो
senior citizen associations. Next.
आवाज आएगी फालतू में
So now, because we want to improve the quality of life care starts from an individual. So therefore, last 6 years, we have coined this slogan that
मेरा स्वास्थ्य
we join everybody in taking a pledge every Friday, जो हम अपना Friday का pledge कहते हैं, and we call it, we all join together and say, may I request everybody to join and say, मेरा
मेरा
स्वास्थ्य
स्वास्थ्य मेरे हाथ, मेरा
मेरा
स्वास्थ्य मेरे हाथ,
मेरा
मेरा
स्वास्थ्य
स्वास्थ्य मेरे हाथ,
starts from there.
मेरा
मेरा
स्वास्थ्य मेरे
स्वास्थ्य
हाथ,
मेरे हाथ।
मेरा
This is what
स्वास्थ्य
all
मेरे
of us
हाथ,
do.
मेरा स्वास्थ्य
Next
मेरे
slide,
हाथ।
please.
नमस्कार।
मेरा
So today we
स्वास्थ्य
have
मेरे
two
हाथ
speakers in our session. We have Dr. Sanjeev Gupta, who's here, who's the head of department of the ophthalmology in Fortis Escorts Hospital. And the second speaker will be Dr. Surakshit TK, who's senior consultant in gastroenterology at the Fortis Escorts. Pragati, next. So the two topics are, Namaskar. The two topics are fatty liver disease, fatty liver in elders, and second is eye care in the elderly by Dr. Sanjeev Gupta. So before we have the speakers, हम एक छोटा सा exercise करते हैं just to get a hold of how well or how in which direction are we going to go. So few very common questions, you can answer them. Next, please. Yes, you can start the poll, please.
Oh, there you go.
So just a minute.
Pragati, are you getting the poll?
Yes, sir.
Okay, so now this is the first question. How often do we experience gas or bloating? Often. How many hands here saying how often do you experience gas or bloating? So nearly daily. Okay. And on our poll, out of the 70 people, 41% are saying sometimes. 29% say rarely. And often is, so sometimes is highest. Next question, Pragati. Pragati, can you do one thing?
Zoom meeting.
There are second questions which are related to the eye. Can you bring that first, please?
Okay.
So Dr. Gupta, next one. Not this one. Those related with the eye. Next. Yes. Okay. So do eye problems affect the ability to read, watch TV, or move around safely? Not at all. So nobody has problems here that affect. Not at all, a little, quite a lot. How many? Quite a lot. Okay. Okay. And on the poll, out of the 70 people there, not at all, little. So most people say not at all. Next question, Pragati. Next question. When you face eye problems, what do you usually do? कोई भी आई में difficulty आती है तो what do you usually do? Consult an eye doctor immediately, use home remedies or glass adjustment, or ignore and manage on my own. इतने disciplined लोग हैं सभी. Very good.
I said home remedy.
Thank you, sir.
Arun,
Thank you, doctor. Thank you.
precious. Very good. Very good. Very good.
Absolutely
Very nice.
Thank you, sir.
Last question, please. Pragati, last question. Okay. Do you currently experience any of the following at present? Blurred vision, watering in or dryness, difficulty in seeing at night, none of the above. None of the above. 1 in 3. 1 in 3. Blurred vision and difficulty seeing at night. How many people here have difficulty seeing at night? Night. Okay. So that's it. Okay, you can stop these questions, Pragati.
So there is one more question.
Okay, one more, please. Go ahead. And dryness. Last question.
Sir, all are done.
Okay. So you could do a phone. Okay, I'm just sharing, Dr. Yeah. Hold on. Yeah, no problem. So this one.
Yeah.
So I'll just, ladies and gentlemen, Dr. Sanjeev Gupta is going to give his presentation on care of the eyes in the elderly. And as ma'am just said, eyes are very precious. And it is not just diseases. Please feel free to ask any doubts that you have. Here we are here to clear doubts. Because normally, most often, I've experienced in the past that elders hesitate to tell the doctors, not because they don't communicate well, वो डर ये लगता है कि हमने कोई तकलीफ बताई नहीं तो ऑपरेशन कर दो. तो एक trust deficit है, and these meetings are meant to decrease that trust deficit.
And basically make it more interactive.
That's society. That's society. You can't do that trust deficit. You can only work. Let's accept that there's a trust deficit. Let's work towards trying to decrease that trust deficit by being honest and transparent in what we are doing. Wherever it is. अगर है तो है. Lekin, yes, we've got to work on it. And in the past, we have felt, in the last 5-6 years, that once we are being transparent, elders are communicating much more. Especially in our wellness chapal, we've got a more enormous feedback कि हमने ये बात करके ये बात मानी. So I think it's our effort to create an atmosphere जहाँ elders do not hesitate to report as early as possible. Because many a times elders in the emergency we have found कि delay करने की वजह से वो problem बढ़ गई. वो delay का reason सबसे common दो ही reason होते हैं. एक है घर पे arrangements नहीं है जाने के लिए. बुजुर्ग is the last man to go. And second is elders themselves say नहीं ठीक हो जाएगा आज मैंने ये कर दिया तो home remedies. And lastly, there are diseases which the elders are not aware of. अभी वो gas पे आएंगे तो we will discuss that. So Dr. Sanjeev is going to speak on eye care in the elderly. Please see the slide. बीच में कोई बात पूछनी हो. It's not a class. It is an interaction. Anytime कोई चीज आपको समझ ना आए, रोक के please ask. Please.
ठीक है. Eye care in elderly. So very warm welcome. So this is our team which is in Fortis. Like I am Dr. Sanjeev Gupta. Then we have Dr. Kinshuk Biswas, Mr. Farhan, and Miss Maria. There am
अभी दे
I.
रहे हैं, अभी दे रहे हैं माइक, अभी दे रहे हैं। इसका मतलब हियरिंग टेस्ट भी करानी है। छोटे से हिंट से हम पकड़ लेते हैं।
नहीं अभी माइक आ रहा है।
चलिए।
Okay. So the facilities which we are providing here are basically a comprehensive eye checkup, LASIK and cataract, retina services, glaucoma services, cornea services, squint management, neuro-ophthalmology, oculoplasty, and ocular trauma. So I am quite sure that you are basically, are you aware of the normal structure of the eye? So, the back portion of the eye is where the macula is. You can see that back portion, that is the macula. The front portion of the eye is the cornea. You have this thing. हाँ, तो बस ये हाँ, ये देखिए ना, ये आपका मैकुलर और ये पीछे जो है ये ऑप्टिक नर्व है जो ब्रेन के साथ कनेक्ट होती है। हाँ. Then you have the pupil and the lens is behind the pupil.
मेरे चंदन ये जा रहा है बार बार, वो आईटी लड़के को यहीं बुलाओ,
बार बार कट रहा है वो। So basically एक eye checkup schedule कैसा होना चाहिए, so and the eye checkup should at least be once in a year. It should be an annual eye checkup. और जो annual eye checkup है उसमें जो आपके normally include होता है, it's a vision test, your glasses are checked, and then there's an instrument which is called as a slit lamp. So through the slit lamp, through the slit lamp, we are able to see the anterior part of the eye, which is the front portion of the eye. So that tells us whether you have cataract or any other disease which is in the front portion of the eye. And then we check the pressure of the eye pressure. And fourth is a dilated fundus examination. Fundus means जहाँ पे हम आपके आईज में ड्रॉप्स डालते हैं, जिसमें कि आपको डॉक्टर अपने चेंबर के बाहर आधा घंटा पौना घंटा बिठाता है. We put drops every 10 to 15 minutes. The idea is to check the back portion of the eye, which is very important in diabetic and in hypertensive patients. So what are the common eye disorders which are there in elderly? We can broadly categorize them in two. This thing. First is vision impairment and blinding disorders. इसमें आता है cataract, glaucoma, diabetic retinopathy, refractive errors and presbyopia, age-related macular degeneration, and eye injuries. Then there are disorders which cause visual discomfort, like just dry eyes, computer vision syndrome, refractive error, ocular allergies, minor infections. Infections can be conjunctivitis होता है, जैसे pink eye है किसी को, then blepharitis. Sure, sir. You see, first of all, obviously, there are certain symptoms of dry eye, that there will be grittiness, there will be discomfort, and it depends on the cause also. What is the cause behind the dry eye? Sometimes if it's a severe dry eye, and if it is ignored over a period of time, it can start affecting your cornea also, the front portion of the eye. It can scar it. That depends, as I said, on the severity of dryness.
There is a wet eyes regular.
Yeah.
What this thing. So
Sorry, I was asking a question. Sorry.
Tearing in the eye.
Regularly from one eye you used to keep an issue and start working. The tear is coming out regular. This is. So what is the basic disease or
watering from the eye can be because of many reasons. It can be because of many reasons. Like Watering can be because of infection, because of allergy. Then there is a condition in which the normal flow. You see, normally what happens when the tears are produced in the eye, there's a hole at the lower lid. Through that hole, it goes into the nose, and through the throat it is absorbed. So sometimes there can be a blockage or a partial blockage. Then there will be a continuous watering also that time also.
It's happening only in one eye.
So probably that is the reason there is a partial blockage. I mean, I am assuming that, unless of course he has allergy or some other infection in that particular eye, right? So you were asking something.
Can you speak in this? Can you speak in
Yeah, sure.
Bolo?
Hello. Hello. Yeah.
For dry eye, you were mentioning that one can put the drops. So, is it okay to put the drops 2 or 3 times a day, or?
No, it is. It also depends on the salt of the lubricating drop, and also of the severity of the disease. So, and these are basically brand names. So basically salt होता है कि उसमें क्या salt है. That is more important. Ideally, I would not recommend using anything in the eye without consulting a doctor first.
Can the tearing cause some blindness?
Particular season which we have over.
Of course, in summers you are going to have dry eye. If there is more.
Winters. I was traveling in Europe in winters, and then there I had how do you find dry eye? Yeah. Well, and my eye started itching one fine morning when I got up. Then I go simple. Morning got up, my eyes were hurting, and then it started.
So there could be.
Started watering. Luckily, I had taken that food.
So there could be many reasons for that. You see, his symptoms.
He is saying hurting.
it
So
could be
every
any.
dry eye, जो शिकायत कह रहे हैं, हम जो शब्द यूज कर रहे हैं, मेरी I got dry eye. जरूरी नहीं कि आपकी आंख dry है. There could be a inflammation in the cornea.
Yeah, there could be
a
anything.
small sty which is coming up.
Watering, there could be.
It will give a sensation of dry eye. So please, यही problem हम सब में है कि हम जो शब्द यूज करते हैं अपनी तकलीफ बताने को, हम उस शब्द को बीमारी समझते हैं. I'm saying that across the board, कोई कहे dry eye इसके लिए क्या होना? Dr. Gupta is saying you try and find out the reason for that. Because
Main thing is to
there
find
could
out
be
the reason.
reasons.
Main thing is to find out the reason.
Please carry.
And the second, of course, cataract. Basically, cataract is opacity of lens, and the blindness from cataract is reversible with surgery and implantation of lens. What are the symptoms of cataract? Basically, blurred vision, frequent change of glasses, increased sensitivity to light. जैसे कि रात को glare आ रही है, especially if you are driving in the night, सामने के vehicle से आपको glare पड़ रही है, faded colors and doubling of vision. These are some common symptoms of cataract. This is just a diagrammatic representation of the most common surgery which is used for cataract, basically, which is called as phacoemulsification. Yeah, this is the, you can see the phaco probe inside the eye. This is the probe which is emulsifying your cataract. This is, in the end, you're putting a foldable lens through an injector. And this is how the lens sits inside the eye after the surgery is done.
How many have had a cataract surgery here? Cataract कितने लोगों ने कराया है यहाँ पे? Not much.
Yeah, I got it done.
Lens the line. Yeah.
Right.
Lens the line, मैंने.
I've got done for both my eyes.
Both eyes.
Yes, that's what I was going to come to that.
Sorry?
See the
care of a cataract.
yeah, I think didn't complete. Then I'll choose.
And then you have glaucoma. Glaucoma, जिसको हम normally काला मोतिया भी कहते हैं, because cataract is normally called as सफेद मोतिया and glaucoma is called as काला मोतिया. So it is basically the disease of the nerve, optic nerve. And why it is dangerous is because normally it is asymptomatic. आपकी vision धीरे 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 कम होती जाती है till you start actually losing your vision. So that's why it is called even as silent thief of sight. Early detection and pressure prevents blindness. Pressure control. नहीं देखिए वो भी एक ना प्रेशर it should be normally be less than 20 but वो भी एक क्राइटेरिया नहीं होता है. उसके साथ और भी टेस्ट होते हैं ग्लोकोमा के, जैसे आपने पेरीमेट्री कर रहे हैं, ओसीटी कर रहे हैं, because there is an entity called as low tension glaucoma also. So pressure is not the only criteria, but normally it should be less than 20. Yeah, it starts involving the periphery first. Gradually it will come. ये जो photo है, अब ये देख रहे हैं photo ये, you can see the picture. You know, so this is the normal one where you can see this child. In early glaucoma, it starts constricting in the periphery. You can see these black areas, and then वो और बढ़ते जा रहा है, फिर ये बढ़ते जाएगा, and then in the end you are left with a tubular vision. Just a tubular. Yes, it starts. So that's why it's very dangerous because आपको मालूम ही नहीं पड़ता है. इसी वो तो आपको एंड में मालूम पड़ता है बिल्कुल जाके. And this is sorry. He can detect it in, sorry? Yeah, he can. That's the, you see, there are certain parameters, like, you know, if you have a family history of glaucoma, if you are a diabetic, and if your pressures are high, then obviously, you know, the next step is to do the testing. You know, there are certain tests which are specifically for glaucoma, like autoperimetry, OCT, fundus pachymetry. Then you do those tests, and then depending on all the reports, then you can start the treatment. If it is started early, it's purely the blindness is preventable. पहले होता था बहुत पहले के, you know, the misconception was there get causes blindness, but now surgery is very rarely done in glaucoma. It is normally controlled by drops only. हाँ जी. Sorry.
Drops are prescribed, so if you put the drops regularly, that should help you keep the pressure.
No, your first line was to prevent glaucoma, some drops. That is not.
No.
To prevent glaucoma, there are no drops.
It's basically treatment of glaucoma.
It's treatment of glaucoma.
There is no drops like prevention.
But if you put drops, then it keeps the pressure.
No. You can't lower the pressure from normal. Somebody has normal pressure, फिर आप drops क्यों डालेंगे?
No, but if you have a tendency for the pressure to increase from normal,
so then you have glaucoma.
Then if you put the drops, then that will help to keep the pressure. And
then that means you have glaucoma. So then
okay, if you have glaucoma,
then there are drops.
But so drops help to prevent.
Yeah,
not prevent.
It will control
or to reduce the impact.
To treat the glaucoma.
Basically, what happens is that you are putting those drops. Those drops have to be put lifelong, and they will suppose by the time your glaucoma is diagnosed, you have 10% loss of vision. Presume. So whatever we are doing is to prevent the 90% loss of vision. That vision which is already lost from glaucoma is not recovered. That's why it's more dangerous. Cataract may you recover your full vision, right? Yeah.
My wife had a cataract at both eyes. Now in one eye, the vision is decreased. So I've gone to a doctor here. Said there's a laser this will do, and then your vision comes back.
Yeah, that's basically called as after cataract.
I have written it here, Mr. Jackie also. That's a particular question I want to ask him. Care after cataract. So we'll come to that in the detail. Let me complete the presentation.
So, and then we have age-related macular degeneration. That also basically affects your central vision. It's blurred or distorted central vision. There will be difficulty in reading, recognizing faces, driving. Basically, ARMD is of two types. One is dry ARMD, which is common, and it's a very, very slow progression. And the other is wet ARMD, which is less common, but it's more dangerous and more severe. So the symptoms for ARMD are that the straight line will appear.
ARMD is just
age-related macular degeneration.
Age-related macular degeneration. जो डॉक्टर साहब ने जब आंख दिखाई थी उसमें एक जगह था मैक्यूला. Macula is the area. Just describe what is the macula.
The macula is the area which is at the retina, is the back portion of the eye, which is mainly responsible for your vision. So macula is the most important part of the eye.
And that can degenerate. It's like graying of the hair. बगैर किसी बीमारी के वहाँ पे blood supply कम होना शुरू होता है and vision goes down. So the only way to do it is to get an examination to find out a special test. Dr. Gupta, how do you detect that?
Basically, it has to be a fundus examination or an OCT. OCT stands for optical coherence tomography. It's like a CT scan. जैसे आप CT scan कराते हैं, जैसे brain का CT scan होता है, head का होता है, तो आई के CT scan को OCT बोलते हैं. वो retina में वो layers के हिसाब से it shows us the layers of the retina, right? So as it will, your vision gets affected like this. You can see the central dark patch. If you have ARMD, this is what a person will see in front of him. This dark circle, right? That is in severe cases, of course. And treatment point of view, if you have dry ARMD, you just need vitamins. There are multivitamins specifically for the eye. But if you have a wet ARMD, then you need injections in the eye. A lot of people get injections done inside the eye. That is mainly for wet ARMD, which is the dangerous form of ARMD. Similarly, you have diabetic retinopathy. That is the effect of diabetes in the eye. Basically, it's damage to the small blood vessels. Vessels will leak or they get blocked. Retina gets damaged, and then there is vision loss. Basic risk factor is if there is long duration and poor diabetic control, high blood pressure, and even cholesterol. Even diabetic retinopathy initially is asymptomatic. And then there is blurring of vision and sometimes there can be sudden vision loss also. And you might complain of floaters. Floaters means you see some black spots which move as you move your eye, So a treatment of diabetic retinopathy is control of diabetes, laser treatment, again injections in severe cases, and surgery for advanced cases. The picture shows a retina which has been lasered. If you see these multiple white spots, this shows that laser has been done. So diabetic retinopathy is also something which we have to closely monitor. If you have diabetes, you must get your fundus checkup done at least once in a year. More important, if you have been having diabetes for 7 to 8 years, because the chances of getting diabetic retinopathy increases after that duration, 7 to 8 years. Plus, it's very important for your physician to know whether you have diabetic changes in the eye or not. Yes, sir.
Is it particular that it's type 1 or type 2 or is diabetes?
Diabetic in general. Yes.
Both.
Because you see, if a person has severe diabetic retinopathy, like for example, there are a lot of changes inside the eye. So it also implies that the diabetes is poorly controlled. The other organs of the body are also involved. That is the importance of a fundus examination. Because बाकी चीजें तो क्या है, आपने ब्लड टेस्ट कराया, ये कराना पड़ता है, वो कराना पड़ता है, ये तो आपको सामने दिख रहा है ना. So that's why a physician tells you to get a fundus examination.
See what Dr. Gupta is trying to emphasize. Diabetes कईयों को है, लेकिन आज की तारीख में डायबिटीज के इलाज का पर्पस क्या है? आपका फास्टिंग शुगर 100 बीपी 120 लाना पर्पस नहीं है. डायबिटीज जो बीमारी है वो हमारे शरीर के 4 अंगों को खराब करती है, दिमाग के नसों को, आंख की नसों को, हार्ट की नसों को और किडनी की नसों को। तो डायबिटीज अगर किसी का हमने असेस करना है कि इसका डायबिटीज कितना कॉम्प्लिकेट हो रहा है, देन रेटिना एग्जामिनेशन विल गिव एन इंडिकेशन कि इनका डायबिटीज कंट्रोल कैसा है, शुगर नॉर्मल, ब्लड शुगर नॉर्मल होने के बावजूद। So these are the newer tests which tell the doctor कि आपका डायबिटीज कितने कंट्रोल में है. These are called complications of diabetes, not just diabetes, and they cannot be detected unless and until you go for a proper eye examination.
And then you have presbyopia. Presbyopia is that you are not able to see things at a near vision after the age of 40. So normally people get it after the age of 40, and this happens is because initially when we are young, when we are less than 40, so when we are looking at a far away point and then we have to look near, the lens changes its shape, the muscles around it changes shape. But with age, this this capacity of our eye to change shape, the lens to change shape, decreases, right? So if it cannot change its shape, then we can't focus near. So that's why we need it to be supplemented with plus number glasses for near. And like dry eye, as we were discussing, it's a common eye disorder. Reduced tear production, poorer quality tears, reduced blinking. Symptoms, typical symptoms would be grittiness, burning sensation.
Is dryness and decrease of the tears, is it also an aging process?
Yes, definitely. And symptoms, typical symptoms would be grittiness, burning sensation, itching and redness, tearing. And of course, you have to see your eye doctor and he will prescribe you the necessary lubricating drops required for your...
Say it again, sir. The dryness and tearing are the same thing or opposite?
Sorry?
Dryness and tearing.
Dryness and?
Tears coming from eye is a symbol of dryness?
Yeah, this basically those are reflex tearing. Basically, tearing, you can have a little bit of tearing along with dry eye also.
Okay.
Okay. Then you have is red eye or a pink eye, as we call it. It could, a red eye you can have because of chronic dry eye. Because if a person has been having a dry eye for long, they can end up having a red or a pink eye. Subconjunctival hemorrhage. Subconjunctival hemorrhage normally happens, if somebody is high blood pressure, the blood pressure is uncontrolled, or if they have suddenly exerted pressure. So the small vessels, they bleed. कई बार होता है कि white portion में red हो जाता है. That's called as a subconjunctival hemorrhage. It's totally harmless. It just looks very red and scary. And normally it resolves after 10 to 12 days. It normally resolves. Then allergies can cause red eyes. Environmental irritants like smoke, air, conjunctivitis and blepharitis. These are some common conditions which can cause red eye.
What is the last one? Blepharitis?
वो IT वाला का लड़का कहाँ है?
What is the last blepharity?
G.
And basically, that's, as I was saying, that's called as a floater. So floaters में क्या होता है कि normally they 90 to 95% of the times they are normal, क्योंकि आपकी एक जेली होती है पीछे, उसके सिकुड़ने से होता है, degeneration से होता है, right? But in some cases it could also be indicative of some kind of tear or a break in the retina. So if a person is having floaters, it is not it's nothing to panic about, but then you must get a retina checkup done by an eye doctor. So what are the sorry? No, it's a normal aging process. It can be. As I said, you need to get an eye examination done. Floaters, unfortunately, there is no such treatment as of now. They gradually fade with the time and person gets used to it, but they don't harm the eye in any way if your retina is fine. Okay.
Sure. They are irritating. They are irritating. देखने वो बार-बार कुछ आ रहा था.
हाँ वो भी हो सकता है.
So sir, they keep on coming and going and वो फिर नहीं होते हैं. So sometimes तो लगता है कि पता नहीं supposing I'm fine for driving, तो सामने हो गया आने तो then you are scared.
Yeah, but you see, as I said, कि there, if your retina is fine, there is nothing to worry.
No, we have
floaters.
I checked nothing wrong with it, but I was.
I know, but I see floaters from my left eye since 20 years. So I got used to it now.
Nothing to worry about.
No, not at all.
Doctor, I have a question.
Sorry.
You said as we age, after 40, your vision gets affected. So वो मेरा भी हुआ. I never had any problem with vision earlier. No glasses, never. Family maybe everybody doesn't have glasses. But अब मेरा क्या हो रहा है? Near vision भी बढ़ता जा रहा है, दूर का vision भी बढ़ता जा रहा है. Does that happen?
It can happen. I mean, of course, आपने eye checkup तो कराया ही होगा बीच में.
You became 40 when you were 60. जो 40 पे होना था वो जाके 60 पे हुआ और जीवा कुछ दोनों
number can change unless, I mean, as long as there's nothing else in the eye. If the eye examination is normal, there's nothing to worry about.
But I think what Dr. Gupta has said, what 40 जो आजकल हम कहते हैं the new 80 is 40. So जो 40 साल पे changes होनी थी वो आजकल 50 पे भी हो सकती है when you are living longer. So it's not just age. It is when it can happen, but it is a progressive thing that comes with age. That's all.
So what are basically the emergency signs, for you? First is that suddenly you cannot see or everything looks blurry. Emergency. Ocular emergencies are very rare. So, suppose you see flashes of light, right? Floaters and flashes are different. Flashes होता है जैसे कि कोई जुगनू चमक रहा है, there's a flash of light. If you have eye pain, and if you are experiencing doubling of vision, or if you have redness or swelling of your eye or eyelid. That could be because of many reasons. It could be because of some allergy or because of infection or something. वो तो एक बारी वो डॉक्टर आपके देखेंगे तभी मालूम पड़ेगा क्या रीजन है उसका. हाँ जी हाँ जी no, pollutants also do make a difference. Pollution. हाँ जी.
About 15 years back, I had floaters थे eye में और ये पिछले 5-6 साल से मैं नोट करता हूँ कि नहीं है, खत्म हो गया धीरे-धीरे अपने आप ही.
वो फेड हो जाते हैं धीरे-धीरे. So the floaters are nothing to be alarmed about as long as the eye checkup is normal. Right? So basically, what are the eye care tips which we should be a takeaway message kind of a thing? We should get a regular eye examination, maintain normal blood pressure, cholesterol, and glucose levels, and a healthy food diet.
Normal blood pressure.
Whatever your physician says is normal for you. So
there is a physician called Professor Nandulal here. He had a department of nephrology. I will put this question to him. Just wait for another 5 minutes. But ये question बहुत ही common है. What is normal blood pressure? And I think Professor Nandulal from nephrology will answer that question to all of you. Just give us 2 minutes.
ऐसा है कि मेरा जो लेफ्ट आई है ना वो 74 ईयर से ही है.
Okay.
74. जो राइट आई है इसमें 45 ईयर्स में चश्मा लगा था और आज ये चश्मा उतर गया. बिना चश्मे के मैं रात को गाड़ी चला सकता.
It's possible. You see, the refractive status of the eye can change as long as आपकी eye checkup normal है. क्यों क्या होता है कई बार क्या होता है कि अगर किसी को कैटरेक्ट है, if it is a nuclear sclerosis, तो उससे माइनस नंबर आ जाता है तो वो उनको नजदीक का दिखना शुरू हो जाता है. वो कहते हैं कि हमको तो नजदीक का दिख रहा है, पहले दिख नहीं रहा था.
जो ये कह रहे हैं
तो इसमें चश्मा नहीं लग सकता है लेफ्ट आई में.
नहीं वो ठीक है. The question is that his vision improved. What Dr. Gupta is saying, it is possible. Nature की तरफ से आपका एक imagine a ball के center में खराबी है या उसके साइड में खराबी है.
अभी तो आंख वाले का
Dr. Gupta,
फैटी लीवर में को लगता नहीं
if the lens center is not is opaque, then can nature with what has
which lens you're saying? I'm talking about your normal lens of the eye or your glasses?
normal. So you know the cataract नहीं कराया, but his vision improved. So what he wants to know is how did it improve?
I need to examine you for that because I'll have to see what could be the reason behind it. अगर आपको पहले आप glasses पहनते थे आप? नहीं glasses आपने शुरू से नहीं पहने.
मैं 45 की एज में लगा ना.
अच्छा, near
अभी कैटरेक्ट नहीं हुआ.
So the opaqueness जगह change हो गई.
81 ना. 81 years है. और इसमें 6 साल की उम्र में स्टिक लगाती थी बच्चे में. इसमें निशान है, कुछ नहीं होता.
वो तो that's a corneal opacity है ना वो.
Dr. Gupta, can vision change over time?
You see,
naturally.
It can, a little bit of variations can be there. आपका जो देखिए जो नंबर होता है ना आई में वो दो चीजों से होता है. एक तो कॉर्निया से होता है और लेंस से होता है आपके अंदर. तो उसके अंदर एजिंग चेंजेस आते रहते हैं. थोड़ा बहुत फ्लक्चुएशन तो हो ही सकता है. हाँ जी, तो वो फ्लक्चुएशन हो सकता है. No, that's a myth. That's a myth. So, and last is exercise and of course to quit smoking. Thank you for your attention.
Thank you. I think before you close, very common चीज आजकल बहुत एक पुरानी कहावत है कि ये मौसम ठीक नहीं है कैटरेक्ट सर्जरी के लिए, बरसात में करना है, वो करना है. Now the new technique of surgery, पहले जो सर्जरी होती थी उसमें चीरा लगता था और टांके लगते थे. These days the surgery is by laser. There is no stitch. It takes it out. Now ये जो लेजर सर्जरी है इसमें और वो टांके लगने जब टांके लगते थे दोनों की केयर में बहुत फर्क है. वो टांके 2 हफ्ते के बाद खोलने होते थे, all those things. But these days those type of precautions are not given. So many of the elders they get confused कि मेरे को तो कुछ बोला ही नहीं, मेरे टांके नहीं लगाए. So just few words on the present technique. How is it? How is the post care different from the previous?
Like recently you must have heard के लोग कह रहे हैं कि robotic eye surgery भी होती है. But then you see only the basic technique remains phacoemulsification, जो जिसकी मैंने आपको पिक्चर दिखाई थी. इसमें कि हम एक प्रोब डालते हैं और उससे लेंस को इमल्सिफाई करके उसमें एक आर्टिफिशियल लेंस डालते हैं. सो उसमें जो इंसिजन होता है वो वॉल्वुलर इंसिजन होता है. तो नो स्टिचेस आर टेकन. अगर जैसे पहले जब कैटरेक्ट होता था तो तब उसमें स्टिचेस लगते थे, हम कॉर्निया को पूरा काटते थे लेंस को निकालने के लिए. तो वंस यू टेक स्टिचेस and if you take more stitches, you know, at least 5 to 6 stitches were taken that time. So post op care आपका automatically हो जाता है. The chances of infection are more. Healing takes more time. But nowadays you can return to your normal work within 3 to 4 days of cataract surgery. And your question was कि you know कि एक पीछे एक लेजर हुआ था, झिल्ली काटी थी आपने कहा.
My wife had to get it done.
Again. Yeah. So that is what happens is over a period of time, if once you have got a cataract surgery done, so you have put an artificial implant inside. Yeah. So that implant keeps on rubbing on the capsule, on the support. So once it is rubbing on the support, जो पीछे capsule होता है ना, वो thick हो जाता है. So that happens normally also. It's not considered as a complication. So in order to clear that, you have to make a small opening in that capsule. So which is done through laser, which is just a 2-3 minutes procedure. That is called as after cataract. Sorry?
What is uveitis?
Uveitis is totally different. Uveitis is inflammation of the parts of the eye, anterior segment of the eye. It can be posterior segment also. जो iris है ना अंदर retina में भी हो जाती है inflammation. तो uveitis is different of course.
That will generally be after cataract.
No. Uveitis is totally different, not related to cataract. No. Uveitis can be, there could be multiple reasons for uveitis. Autoimmune भी होता है. Suppose आपको कोई बीमारी है, it can be a manifestation of that. So if a person has uveitis 2-3 times, so then we tell the person to get a physician checkup done so that they can rule out कि कोई और problem तो नहीं है, ankylosing spondylitis से होता है, rheumatoid arthritis से हो सकता है, और भी चीजों से हो सकता है, which can be a manifestation.
Uveitis is a proper disease.
It's a disease. It's a proper. It's not related to cataract at all.
So we have some questions in the chat box. Dr. Gupta will take it later after Dr. Surakshit's presentation. So friends, that was Dr. Sanjeev Gupta, the head of department at the eye department at Fortis. They have recently started here. And now we will have the second talk by Dr. Surakshit on fatty liver. And PPT खोलेंगे?
मशीन के ऊपर है.
So meanwhile, while Dr. Surakshit का वो PPT खोल रहे हैं, it's a pleasure to introduce Professor A.S. Nagula, who is the head of department of nephrology, and I think we'll take this opportunity for him to answer. Nephrology, as you know, is the science of care of the kidney. और आज की तारीख में दिमाग से ज़्यादा कीमती किडनी होगी. तो kidney is more damaging than the brain. So, and it's a very slow damage to the kidney. But I think Dr. Gula can, in his words, answer the question, because most important, and let me share with you, आज की तारीख में हम ब्लड प्रेशर कंट्रोल कार्डियोलॉजिस्ट को कम रेफर करते हैं, नेफ्रोलॉजिस्ट को ज्यादा रेफर करते हैं. That is a change in our own working system. पहले बीपी था कार्डियोलॉजिस्ट. Nowadays, any blood pressure जो कि हमें कंट्रोल नहीं हो रहा, we refer to a nephrologist. He will tell you the reason why.
Thank you very much, sir. This is the second or third time you are coming here. All of you read Times of India? Yeah. So today you also saw the first page of Times of India on the reverse side. Anybody saw that? Yes. The filter of life.
Filter of life.
So if you go to that first page, there is a full page advertisement called
Farah
Filter
Khan.
of Life.
Farah Khan is.
And Farah Khan is there. I'm sorry to be asking, but how many of you can use your smartphones? You have? Anyone? Okay. So what I did was I downloaded the QR code. So you download this QR code.
उसी अखबार के पेज.
हाँ, तो आप इससे ले लो. Take this QR code.
Very good idea.
Next time, when the doctor tells you, yeah, take this QR. Take it. So next time when you visit the doctor and you say, I've got a kidney issue, and he says, 40 gram protein cow, 50 gram protein cow, and you don't know what that is, you don't know. You don't know what that is, so go to this QR code, take it, and then you point it to the food that you're eating. It will tell you how many gram protein is there in the food.
Gemini will also tell you that.
It does?
Gemini
will it tell you protein content? No, this will tell you how much protein there is. You can project it on the screen if possible.
This is from the inside of Prime Minister.
First page.
Yeah, so all of you must click and read about it.
Full page.
So rather than having a theory blog, I said, give you a practical session. दूसरा someone asked about BP. तो आप सब घर में BP लेते हो अपना अपना, right?
Let us start with the second.
They need to be calibrated. Before Doctor he takes over the talk, just one question for me. So someone asked me, BP कितना होना चाहिए? अलग-अलग डॉक्टर अलग-अलग BP होते हैं. तो आप सब घर में बीपी लेते हो? आप आइए।
Sir, voice is not clear.
This is the BP instrument. Come.
Sir, voice is not coming.
So आप इनका बीपी लीजिए।
मेरा तो नॉर्मल है।
नहीं कोई बात। I just want to tell you what are the mistakes we make.
मेरे को बीपी है नहीं।
No. My idea is not that. My idea is to tell you that we are taking the BP wrongly.
Proper way.
हाँ, एक बारी proper way कर लो. Now you know why doctors differ. ठीक है सर, आप बैठिए। That is good enough. So हम घर में सब ऐसे ही बीपी लेते हैं। चल वही बैठ, पहला हाथ सामने कर, बांधा और बीपी लेते हैं। So wrong BP taking can increase your blood pressure by 10 millimeters of mercury. The correct way to take blood pressure is come sit down, both feet on the ground. It should not be inclined. ये नहीं कि चाय पी रहे हो और साथ में चल भाई बीपी ले लो. That is wrong. No tea, no coffee, no smoking, no running and taking BP. Come sit down. ये देखो हाथ किधर है और BP instrument किधर है.
Same height.
So the hand should be resting on the table. Hand should be resting on the table. And then you should take the blood pressure. That will give you the correct blood pressure. Then you get it. Sit next to a table. Never go to a doctor's chamber and put your hand out. Most of the time, हम लोग ऐसे खड़े-खड़े BP ले लेते हैं. That is wrong. This is the correct way to take the blood pressure. Now, why the books say that 130/80 is the correct blood pressure, but in a clinic, अगर BP 140/90 होता है तो हम बोलते हैं चल भाई ठीक है, don't bother too much. No, because we don't take the BP correctly. This is the correct way of taking the BP. If in this the BP is more than 130/80, that means you've got hypertension. But the pressure should be taken correctly. Yeah. So this instrument takes it only once. अब देखो इनका बीपी कितना है? I'm surprised. भाई साहब आप बोलते हो बीपी नहीं है? इसमें तो बहुत ज़्यादा है. कितना है? अभी बताता हूँ.
ये प्रॉपर ले रहा हूँ.
नहीं
ये प्रॉपर ले रहा हूँ. आम वगैरह प्रॉपर है. आम वगैरह प्रॉपर है.
अभी देखिए आपका बीपी कितना है.
So we are not seeing anything.
See, this is the wrong way of taking BP. इतने लोग देख रहे हैं और BP ले रहे हैं.
We are not seeing anything. What is being?
No, the talk is just about to start. Just hold on. He's
No,
taking
but this BP thing we are not able to see.
Okay.
Thank you.
बहुत ज़्यादा आ रहा है. So Professor Narula is just telling the right method of how to take blood pressure.
So his blood pressure is coming as 179/85.
We would have liked to see it, but we are not able.
So when you go home,
We'll have a special session for
sit
that.
down,
Okay, thank you.
put your hand on the table and take your blood.
Sir, right or left? आपको correct way में check करके.
करेक्ट वे तो यही है.
धड़कन तो बढ़ गई.
घर जाके. थैंक यू वेरी मच.
There are two things. एक is method and second his question was what is normal blood pressure. एक तो तरीका ही. So what is normal blood pressure these days is not any normal figure. It is a range and that range has to be अगर किसी पर्सन का डॉक्टर गुप्ता देखते हैं कि रेटिना में डैमेज आ रहा है तो उसका ब्लड प्रेशर नॉर्मल कम होगा, वैल्यू कम देखा जाएगा. If somebody has no disease, we can accept the blood pressure 149. So there is nothing called as normal blood pressure. It will depend upon the complications the individual is having within.
Which is the arm using for the
Yeah. So normally there is a difference of 10 between the right and the left. But always go for the higher blood pressure. Control. Like he said, if you have a disease, if you have little albumin in the urine, 120/80 is the normal blood pressure. If you have nothing, up to 130/80 is normal blood pressure.
Which arm should be used?
Whichever is the highest. Normally there's difference of 10. The left arm. Yeah, no, left arm is matter. Some people it is higher, some people it is lower. So you take it both. And always take 3 readings, not 1 reading.
These are things of monitoring at your home based on the instructions of the doctor. Please don't try and decide on your own. कि आज मेरा blood pressure ठीक है. आप क्या करें?
मैं डॉक्टर शुक्ला से बात डॉक्टर साहब
डॉक्टर शुक्ला
जैसे आपने कहा कि कुर्सी में बैठ के करना है
बिल्कुल both feet on the ground.
बैठ में पैर नीचे चले जाते हैं
Bed में you can't rest your arm.
हाँ ये वो है
So if your arm is stiff, BP will go up by 10.
okay
So that's why rest.
Ideally, get your BP checked once at the doctor's chamber and find out and then inform. But remember, sorry, no, but remember, BP जितना भी हो, उसके बारे में क्या करना है वो फैसला खुद मत करें. That is the important part. Whatever is your reading, take your reading and ask the doctor what should I do.
My question is, there's so many devices, plans available.
You're all safe. You're all safe. You're all safe.
Any electronic device, the one commonly available is on the. You must carry your device to the doctor's clinic. You let him take it manually, and then you make it with your device. So you know what is the difference.
It doesn't matter.
But you doctors,
That is gone, not allowed. Mercury manometers are banned all over the world.
Mercury खत्म हो गई, तो ये हवा वाली या डायल वाली.
I think let's first give a thanks to. I now request Dr. Suchit, who's the senior consultant gastroenterology, to speak about fatty liver and gas. We all suffer from gas. All elders come in with the gas in front here. How many types of gas? Dr. Surakshit will let us, please.
Good evening, everyone. So coming to fatty liver in the elderly. So when we speak of fatty liver, so I'm sure everyone in this room would have come across the term fatty liver. So it's an incidental finding. So whenever you get an ultrasound, so most of us may be diagnosed with fatty liver. So if you look at the prevalence of fatty liver in normal individuals, in India, it's somewhere around 30%. It differs between various population, but approximately around 30%. And why is it important in elderly? Because of the risk factors. So if you look at diabetics, so almost the prevalence of fatty liver in diabetes rises to 60 to 70%. That means almost 1 in 3 will have fatty liver in diabetes. And at the same time, unfortunately, fatty liver is something which is reversible. It is completely reversible. Liver is one organ in the body which can regenerate. Despite having so much of inflammation or scarring, there is a tendency for the liver to regenerate. So it's very important we diagnose early and we take precautions so that it will not progress. So if we why is it important to diagnose early? So it can progress. So simple fatty liver is reversible if it is picked up early. So whenever there is excessive fat within the liver, there is inflammation, sujan aati hai liver. So whenever there is inflammation, the normal liver cells get destroyed. So they get replaced by scar tissue. So basically there will be slow process of the liver cells getting replaced by scar tissue. And gradually, whenever there is sufficient amount of liver tissue is destroyed, there is excessive scar tissue, the liver becomes cirrhotic. We call it cirrhosis. Cirrhosis is a stage where it is irreversible. And that is the time we start seeing the complications of liver disease. Okay. So what are the complications of liver disease? Liver is a main organ where whatever we eat, it gets filtered, it gets absorbed through all the blood vessels and it reaches the liver. Is the first organ where it will detoxify all the whatever the toxins that are produced in the intestinal bacteria, and it is filtered. Only selectively all the nutrients, everything is circulated into the blood. So liver is one organ which it is also a storage organ. It plays a very important role in maintaining the blood glucose homeostasis in the body. So it also synthesizes many factors, clotting factors, protein, albumin, all those things are synthesized in the liver, and at the same time some drugs and other toxins are also excreted in the liver by bile. So this is the major function of the liver. So liver function gets affected, you see complications of liver disease. So liver disease का complications क्या हो सकता है? So end stage liver disease का complications. So normal अगर fatty liver है, so most of the time fatty liver is asymptomatic. We don't see any symptoms of fatty liver. Whenever there is advanced liver disease, that is the stage a person starts developing symptoms. So लोग बोलते हैं मेरा LFT तो बिल्कुल ठीक है, but ये नहीं है कि अगर LFT नॉर्मल है, लिवर नॉर्मल है, ठीक है? सो लिवर हैज सफिशिएंट रिजर्व. सो जब तक 70-80% लिवर डैमेज नहीं होता है, तब तक लिवर रिलेटेड कोई सिम्टम्स नहीं आती है, ठीक है? विल कम टू दैट. So when we talk about elderly, so fatty liver, it progresses over a period of time. So someone is diagnosed fatty liver now. So the complications of fatty liver develop after say around 15, 20 or 25 years, depending on his lifestyle. So in elderly, we don't know since how long this inflammation or the damage is happening. So it is very important we detect earlier with routine checkups. And it's a silent, it's a lifestyle disease. So whenever there is a risk factor, increase in risk factors, in elderly, the risk factors, the diabetes is the most important risk factor for fatty liver. So as the age progresses, the prevalence of diabetes and lifestyle, sedentary lifestyle, walking करना, exercise करना, वो कम हो जाता है. So all these are risk factors for fatty liver. As we grow older, so the risk factors also increases. So the prevalence of fatty liver also increases. So what is fatty liver? So normally there is fat within the liver that is completely normal. So whenever there is more than 5% of fat in the liver, we call it as excess fat, that is fatty liver. Okay, so it is recently the term is changed. So we don't call it as non-alcoholic fatty liver disease or fatty liver per se. It is called metabolic associated liver disease. In the sense, metabolic मतलब उसमें बाकी सारी चीजें भी इंक्लूड करना जरूरी है. मोटापन है, ओबेसिटी है, या कोलेस्ट्रॉल, डिसलिपिडीमिया, हाई कोलेस्ट्रॉल लेवल्स, या डायबिटीज है, हाइपोथायराइड है. All those things can be risk factors for fatty liver. So it is to include all this, it has been renamed as metabolic associated fatty liver. So normally it's a incidental finding. Annual ऐसे health checkup के लिए गए, ऐसे ही अल्ट्रासाउंड किया, so अल्ट्रासाउंड में fatty liver आ गया. So this we've already discussed. So what are the major risk factors? Diabetes, high cholesterol, high blood pressure, obesity, low physical activity. One more myth जो है कि मैं उतना मोटा नहीं हूँ, मैं पतला हूँ, मुझे फैटी लिवर नहीं हो सकती, ठीक है? दैट इज ऑल्सो अ मिथ, ठीक है? ऐसे नहीं कि पतले इंडिविजुअल में फैटी लिवर नहीं हो सकता, ठीक है? एशियंस पर से और इंडियंस आर वेरी हाई रिस्क फॉर, हमारा जो फैट डिस्ट्रीब्यूशन अगर देखा जाता है, सो इट्स कंप्लीटली डिफरेंट फ्रॉम द वेस्टर्न पॉपुलेशन. अगर किसी को वेट पुट ऑन होती है, सो वेस्टर्न पॉपुलेशन में पूरे शरीर में डिस्ट्रीब्यूट होती है फैट, बट इंडियंस इट इज द फर्स्ट इज द विजरल फैट, ठीक है? सो एब्डोमेन में जो फैट होती है, दैट इज द वर्स्ट थिंग, ठीक है? सो इंडियंस टेंड टू डेवलप और टेंड टू हैव मोर विजरल फैट देन द वेस्टर्न पॉपुलेशन. जो अगर पतला इंसान में भी विजरल फैट काफी ज्यादा हो सकता है, और उनमें भी नॉन मेटाबॉलिक एसोसिएटेड लिवर डिसीज या नॉन अल्कोहलिक फैटी लिवर डिसीज होने का रिस्क रहता है, ठीक है? सो विद एजिंग, जो लिवर में जो इंसल्ट है, इट इज गोइंग ऑन फॉर सच अ लॉन्ग टाइम, एंड वी लूज मसल मास विद एजिंग, and also we tend to develop more abdominal fat with age, and gradually the physical activity also decreases. All these are risk factors for developing fatty liver. So as I told, most of the times it is asymptomatic. We don't have any symptoms. Mild discomfort हो सकता है, जैसे फैट ज्यादा डिपॉजिट होती है तो लिवर ग्रेजुअली इंक्रीजेस इन साइज, सो लिवर का कैप्सूल स्ट्रेच हो जाता है, सो समटाइम्स राइट साइड में ड्रैगिंग सेंसेशन या कंटिन्यूअस डल एकिंग सेंसेशंस वो आ सकती है. So can it be serious? Yes, it can be serious if it progresses. So whenever we see a fatty liver, अगर किसी को fatty liver diagnosis हुआ है, so we need to assess कि अभी liver में सिर्फ fatty liver है. अगर fatty liver है तो whether it is reversible, whether there is scarring within the liver, हद से ज्यादा liver damage हुआ है कि नहीं, वो assess करना चाहिए. So उसके लिए basic tests क्या क्या हो सकती है. So one, after an ultrasound, most of the times we see ultrasound में fatty liver होती है. So there is nothing, ultrasound is a subjective test. कोई radiologist बोलेगा grade 1 fatty liver, कोई और radiologist will say grade 3 fatty liver. So it's a subjective test, it differs. So objective assessment जो होती है, so for that we need a fibroscan. So in fibroscan, what we see is we see two parameters. One is how much of fat is there in the liver that we can exactly quantify it. Two, whether there is liver stiffness. So fibroscan में कुछ ultrasonic waves होती है जो it detects it gets reflected. So whenever there is excessive scarring, तो liver का stiffness fibroscan में पता चलती है. ठीक है, so median values करके बोलते हैं. So fibroscan median value should be less than 8. That means liver is soft, there is not much of scarring that has happened, so it is still in the reversible phase. So if fibroscan values are in the borderline, yes, still there is some chance of reversibility. If it is more than 13, we take it as liver cirrhosis. So whenever there is liver cirrhosis, that means it's already in a advanced stage, there is excessive scarring within the liver. So these are the ones which should be managed more aggressively. अगर किसी को weight loss करना है, अगर fibroscan ज्यादा है, तो definitely more aggressive weight loss करना होगा, more aggressively liver के regarding counsel करनी है और treat करना है. ठीक है? So two things that we look at: ultrasound, fibroscan, and some liver tests. So liver function test में we see bilirubin levels. Usually they don't matter, so they don't increase much. So it is the AST and ALT levels, liver enzymes बोलते हैं. So liver enzymes अगर marginally elevated है, that means there is some inflammation that is going on in the liver. So the main thing that we look at is AST, ALT and fibroscan. So suppose अगर fibroscan liver cirrhotic के range में है, then we also should have to assess the complications that are related to liver cirrhosis. Liver cirrhosis के complications क्या क्या हो सकता है? एक, खून के नसें फूल जाते हैं, वारिसेस बोलते हैं. ठीक है, सो जब लिवर सिरोसिस होती है, लिवर सुकुड़ जाती है, सो लिवर के अंदर जो मेन ब्लड वेसल्स जाते हैं, पोर्टल वेन बोलते हैं, उसमें प्रेशर बढ़ जाती है, वी कॉल इट पोर्टल हाइपरटेंशन. पोर्टल हाइपरटेंशन की वजह से खून की नसें ईसोफेगस में और स्टमक में फूल जाते हैं, एंड इसमें ज्यादा फूलने की वजह से कई बार खून की उल्टी हो सकती है, ब्लीडिंग हो सकती है, विच कैन बी लाइफ थ्रेटनिंग. दूसरा चीज है, पेट में पानी आ सकता है, and fatty liver per se is a risk factor for liver cancer. ठीक है, so इसीलिए हमें जिसको अगर लिवर सिरोसिस है, हर 6 महीने में या साल में अल्ट्रासाउंड और एंडोस्कोपी, दो चीजें करना होता है. So we've discussed this. Then coming to treatment of fatty liver. So fatty liver, first and foremost, lifestyle changes, diet and lifestyle changes. So one more myth ये है कि फैट खाने से लिवर में फैट बनती है. Yes, definitely फैट खाने से होती है, but फैट खाने से लिवर में फैट नहीं बनती है. It is more important कि मीठा खाने से. ठीक है, so whatever we eat, high carbohydrate diet या sweets जो intake होती है, so that gets converted into triglycerides and they get stored in the liver. So ज्यादा मीठा खाने से लिवर में चर्बी बनती है. ठीक है, फैटी लिवर. So it is very important कि कार्ब्स कट डाउन करना है. ठीक है, शुगर्स को कट डाउन करना है. फ्रूट जूसेस या पैक्ड ड्रिंक्स, कार्बोनेटेड ड्रिंक्स, पेप्सी, कोक, ये सारा चीजें रिस्ट्रिक्ट करना है. अल्कोहल इज आल्सो वेरी इंपॉर्टेंट. ठीक है, सो ये चीजें कट डाउन करना है. प्लस so there is no safe limit of alcohol. If you have a liver disease, no alcohol. If your liver is fine, that is up to you. nobody will recommend alcohol. Okay.
Up to you. How much you want to damage?
Sorry?
No, drinking is that you decide how much you want to do.
Okay. Yeah. So then exercise and weight loss. So अगर liver में fat चर्बी कम करने के लिए we should aim at losing between 5 to 7% of our existing weight. Suppose 90 is your weight, you should be aiming somewhere around 6 to 8 for a meaningful weight loss and reversibility. ठीक है? And again पतले individual बोलेंगे कि मुझे तो ये नहीं, मेरा वेट ही इतना है, मैं क्या करूं, वेट लॉस करना है. Yes, उसमें we don't recommend weight loss per se. अगर आपका वेट कम है, still you have advanced liver disease, you should concentrate more on strength training. ठीक है? So muscle build करना है और fat content. ठीक है? उसमें we have something called as आजकल सारे weighing machine में bio impedance analysis होती है. ठीक है? So that will tell how much percentage of muscle is there in your body, how much of fat is there in the body. So overall, we need to try and target bringing down your fat percentage and increase the muscle percentage in those physical activity, any form of exercise, say 30 to 40 minutes a day, at least 5 days a week. That should be the target. Okay. And last and most important, control of diabetes. Okay. So diabetes control karna and management of hypercholesterol. Okay. Cholesterol or triglycerides. Okay. This should be the overall principle for the same. So diet for liver, mainly you should consume more fruits and vegetables, whole grains and protein, reduce sugars, sweets, refined carbs and fried items, and drink good amount of water. Myth, only alcohol causes fatty liver. No, there are metabolic causes, diabetes, hypercholesterol, hypothyroid, all these are risk factors, obesity, sedentary lifestyle, all these are risk factors. Okay? Fatty liver causes symptoms? No. Most of the times it is an incidental finding. People don't have any symptoms related to fatty liver. And काफी लोग बोलते हैं liver detox कैसे करना है, ठीक है? So there is no such thing called as liver detox, ठीक है? Stay away from all products, ठीक है? So जो भी liver detox करने के लिए कोई products नहीं है. It is not proven. Nothing is efficacious. It can even worsen or harm your liver, ठीक है? So liver detox के लिए main diet, exercise, and cutting down alcohol. That is a major detox regime. Okay. So I would recommend everyone should get annual liver function test. Okay. Suppose if you have diabetes, you should get a fibroscan. Okay. Anyone with a family history of liver disease or who's overweight or obese, they also should get a fibroscan. If somebody has persistent fatigue or ultrasound, there is grade 3 or grade 4 fatty liver, grade 2, grade 3 fatty liver, then definitely you should consult a doctor. Okay? So that's about fatty liver.
Thank you.
Thank you, Dr. Surakshit.
Thank you, doctor. Thank you.
Fatty liver हमने क्यों choose किया, and there are two different, because elders में Dr. Surakshit is very I don't blame the elders totally, क्योंकि जब भी अल्ट्रासाउंड की रिपोर्ट आए उसमें लिखता है फैटी लिवर grade 2, but when they go to a doctor, doctor says नहीं, this is nothing. So my first clarification from you on behalf of them is जो simple जो अल्ट्रासाउंड होता है, is that enough to diagnose fatty liver?
Not. If you have diabetes, you should get a fibroscan.
So the fatty liver का diagnosis ultrasound से नहीं होता, वो fibroscan से होता है. In the elderly, if somebody has a fibroscan report which is indicating fatty liver, what are the complications a person, an elderly beyond 70, can have only because of fatty?
So beyond 70, we don't tend to treat more aggressively. So at age of 70, if your fibroscan says fatty liver, but your liver stiffness, as I told you, there are two things in fibroscan: liver stiffness, liver fat. Only if there is liver fat in excess, nothing to worry. Okay. If liver stiffness is high, then yes, that is something we should look at aggressively. just having a fatty liver in a someone who's around 70, 75, and LFTs are normal, and fibroscan, the liver stiffness is normal, I would not recommend anything more aggressively. Just control of blood sugars and lifestyle changes. That's all.
And lastly, sugar intake can cause fatty liver. It is not fat that causes fatty liver. Sugar intake is a bigger risk factor to cause fatty liver. Is that correct?
So our diet is majorly carbohydrate based diet. ठीक है, अगर हम देखते हैं 2-3 रोटी, इतना सा चावल और उसके साथ इतना सा जो दाल या कुछ सब्जी होती है. So if you look at it, the carbohydrate portion is somewhere around 60-70%. जो major energy है carbohydrates, बाकी कुछ fat और protein से होती है. So protein requirement, especially in elderly, should be at least 1 gram per kg. ठीक है. So वो normal Indian diet में इतना लेना मुश्किल है. ठीक है. So my suggestion is decrease your carbohydrate portion. एक रोटी या थोड़ा सा चावल का portion कम कर लो. उसके जगह 1 कटोरी दाल या एक्स्ट्रा कुछ सलाड्स में स्प्राउट्स, ठीक है, सो या पनीर, ठीक है, नॉनवेज सोर्स में फिश या चिकन, एग वाइट्स, सो इसको इंक्लूड करो और डाइट को मोर प्रोटीनियस बनाना चाहिए.
तो जैसे मैंने बनाई थी ना वैसे ही बना दे.
ठीक है, सो सलाड्स प्लस दिस थिंग. If you are diabetic, hypertensive, or any heart disease per se, yes, it is harmful, not from the liver point.
What we generally suggest is to have 1 full egg and 1 white of the egg in the morning. So that gives your adequate amount of protein, plus you have your taste of it. Any other questions for
coffee?
Sorry, coffee. Protein powder. Okay,
So
very common.
protein, normal whey protein, जो है, that is completely safe. You can have whey protein.
Whey protein.
It's a good branch, but not some adulterated या body building या mass gain करने के लिए जो proteins होते हैं. So I would stay away from those because
protein powder
so वो सारा चीजें adulterated होती हैं. So plain.
Normally कितना protein powder
So requirement is according to your body weight. ठीक है, अगर किसी का body weight 80 है, 80 is the requirement. Protein. So protein powder depending on your diet, ठीक है, at least 1 या 2 scoops. Usually 1 या 2 scoops में you get around 15 to 30 grams of protein. So that should be adequate. And regarding coffee, yes, coffee is definitely good for liver. 2 to 3 cups of coffee. But ऐसे नहीं कि coffee में इतना दूध और sugar डाल के, ठीक है. So it should be a black coffee, ठीक है. Yes.
You were asking something. नहीं, liver के बारे में no, I told you that बाद में बात करें. Okay. So somebody who's thin can also have fatty liver disease. So fat in liver and fatty liver disease दो अलग-अलग बात हैं. And I wanted to clarify. मैं अक्सर जब वेंडर्स को पूछते हैं आँख चेक कराई, यहाँ मैंने करा ली, क्या चेक कराई? वो हमारा ऑप्टो वो चश्मे वाला है, उससे जाके हमने आँख चेक करा ली. What Dr. Gupta just told you, that is only your vision. What in elderly it is important to find out is the pressure for glaucoma and the retina for diseases. So please don't feel safe अगर आपने वो चेक कराया है. अपनी आई के इंटरनल पार्ट को भी चेक कराना बहुत जरूरी है. That is only. Anything you would like to say?
No, I think GREWAL has rightly put. आई चेकअप हमें एक प्रॉपर आई चेकअप भी कराना चाहिए डॉक्टर से. The optometrist or the optical shop people, they are just qualified to give you glasses only.
That's
not advise any treatment or future course of action.
So I just want to make one simple announcement. Pacific One Health is an organization which is coming up with a elder care program. Our elder care program is now going to be adopted by Pacific One Health. We have an Elder for Elders program running in the community. So we have Mr. Siddharth on 7th of April. Normally World Health Day मनाया जाता है. तो India Habitat Center में we are celebrating World Health Day for the elders with a अंग्रेजी में उसको एक्सपो कहते हैं, पंजाबी में उसको मेला कहते हैं. So we are having a small मेला for the elders there. तो उसकी रजिस्ट्रेशन के लिए Mr. Siddharth, you have the you can give your names to Mr. Marwa. He will get you registered and you will get a reply. It's from 10 o'clock onwards. They have a lot of games, a lot of prizes, and it's like a mela there. And they have lunch after that for the elders.
Breakfast also.
The tea and snacks will be carrying on from the 10. So it's just an experience for the elders to be included. Actually, there is a full day conference on care. So आज हमारी कोशिश है कि elders को inclusive रखें. Let them be included in every event that is being organized. Therefore, we requested them to invite our elder friends. Whoever wants to come can give their names to them. So, with this, we.
आप बहुत बड़ी देर हो गई सर आपको बैठे हुए और बड़ा मामला सीरियस चल रहा है. इसी के चेहरे में मुस्कुराहट नजर आ रही. तो सबसे पहले मैं डॉक्टर संजीव गुप्ता जी से पूछ लेता हूँ. डॉक्टर साहब, उन्होंने पूछा था कि एक्सरसाइज करने से या कोई ऐसी एक्सरसाइज करने आ रही थी उससे आंखों की रोशनी बढ़ती है.
नहीं, जैसे मैंने कहा था कि वो बेसिकली मिथ है. आई एक्सरसाइज से कुछ नहीं होता है. मेनली है जब किसी को कन्वर्जेंस इनसफिशिएंसी हो या कुछ हो तो उसमें हेल्प करती है, बट नंबर से कोई रिलेशन नहीं.
और डॉक्टर साहब, हमने सुना है कि आपको आंखों में बात होने दो या निगाहें मिलाने को जी चाहता है, उसके लिए क्या करें? किसी से निगाहें मिलाने से आंखों में रोशनी पड़ती है.
ये तो देखने वाले के नजरिए पे है.
उन्होंने जो जवाब दिया कि देखने वाले की नजर से, वो कह रहे हैं जब डॉक्टर के साथ आंखें मिलाओगे तब नजरें ठीक हो.
तो डॉक्टर आपसे हम आंखें नहीं मिलाएंगे तो डॉक्टर को दूसरा ढूंढते हैं. लेडी डॉक्टर को ढूंढते जल्दी आंखें ठीक हो जाएंगी. जब 2000 में डॉक्टर संजीव गुप्ता जी, अब मैं जो बात करने जा रहा हूँ आपको कितना है
बिरयानी चाहिए कि पिज्जा? बिरयानी खानी है पिज्जा?
अगर डॉक्टर सुरक्षित से आप हर 3 महीने
क्या है? बिरयानी खानी है कि पिज्जा? हाँ, खाने कौन सा खाना है, बिरयानी या पिज्जा?
पिज्जा
मंगा लो. पिज्जा. हाँ.
अच्छा, डॉक्टर सुरक्षित के साथ हमारे काफी सालों बाद 1-2 साल बाद हमने प्रोग्राम किया है. मतलब इनकी जो मुस्कुराहट है, तो मुस्कुराहट आपकी भी कम नहीं है सर. मैं इन दोनों के लिए बोल देता हूँ कि मुझे कहा है बोलूं तो बोल देता हूँ कि देख के आपकी दोनों डॉक्टर ग्रेवाल का नाम लिया तो ये गड़बड़ेगी मुझसे. देख के आपकी मुस्कुराहट हम होश गवा बैठे. देख के आपकी मुस्कुराहट हम होश गवा बैठे. हम तो होश में आने ही वाले थे कि आप फिर मुस्कुरा बैठे. We are very thankful to you, sir, कि आपने अपना टाइम दिया है. और ये जो हमारे आए हुए हैं सर, अब ये घर में बैठ के सर कई बातें अपने वाइफ के साथ या हस्बैंड के साथ बैठ के जरूर डिस्कस करेंगे. और वी विल लेट यू नो कि आपसे क्या मैंने जो बात कहा है कि 3 महीने में अगर
वाह 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 वाह
आप हमेशा सुरक्षित ही रहेंगे. थैंक यू वेरी मच.
मारवा साहब, great.
Marwa sahab, before we go,
That's great.
It is time to close, but before we close, once again, let us take our pledge and take our pledge by reminding each other that we take our pledge. मेरा स्वास्थ्य मेरे हाथ, मेरा स्वास्थ्य मेरे हाथ.
Thank you, Doctor Saab. Thank you, GREWAL.
Very nice.
Thank you, Doctor Saab.
मेरा स्वास्थ्य मेरे हाथ.
मेरा स्वास्थ्य मेरे हाथ.
मेरा स्वास्थ्य मेरे हाथ.
मेरा स्वास्थ्य मेरे हाथ. Thank you, Doctor Saab. Thank you. Thank you, Doctor Saab.
Thank you, sir. Thank you, Gulati ji. Thank you.
I highly oblige. Very, very beneficial program. Really. Very well explained everything. Thank you.